Hi, I'm Dr. Kathy Stallworth, and today I'd like to talk to you about carpal tunnel syndrome. One of the primary symptoms of carpal tunnel syndrome is tingling and numbness in basically the thumb and the first 3 fingers of the hand. How does carpal tunnel syndrome occur? The median nerve travels down through the wrist along the forearm. As it enters the wrist, it goes underneath this ligament. If you develop any type of tendinitis or just through normal aging and wear and tear, you can develop impingement of the median nerve as it goes through this carpal tunnel. So certainly one of the most common symptoms of carpal tunnel syndrome is numbness or tingling. Other people can have weakness in the hand as well. I always recommend conservative treatment to begin with and then moving up to more advanced interventions. So certainly one of the first things that I recommend for people is that you take an anti-inflammatory drug such as ibuprofen or naproxen, again, to try to get the swelling down out of that carpal tunnel. Another thing that I recommend initially is wearing splints, particularly at night. And Ani has got one of these splints on. So would you demonstrate that for us, Ani? Thank you. You don't have to have a splint that's this sophisticated. Mainly what you need is a splint that will decrease the back and forth movement of the wrist. Other things that we recommend are activity modification. So if you're someone who works with a lot of repetitive hand activity or a lot of keyboard type activity, you may need to modify what you're doing at work. Certainly having your hands in a neutral position as opposed to having them really extended will help. So definitely pay attention to what you're doing at work. Take lots of breaks. So if you're typing, every 30 seconds or every minute, pause, take a little break, shake your hands out, and get back to the typing. Certainly if your symptoms persist in spite of these simple measures, you want to seek the services of a physician. You may need further evaluation, diagnosis, and treatment.